Hi everyone. Today we will talk about adult BLS, that is basic life support. BLS refers to the immediate care given to someone who is experiencing a life-threatening emergency such as cardiac arrest or respiratory arrest. Main goal is to save life. Cardiopulmonary resuscitation is an emergency life-saving procedure when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. The American Heart Association vision is a world where no one dies from cardiac arrest. Every year, 350,000 people die from cardiac arrest in the United States. Big number, bigger opportunity. With your help, we can bring that number down to 0. This is the vision of AHA, American Heart Association. Now we will see what is difference between heart attack and cardiac arrest. In heart attack, there is a blockage in coronary artery. The person usually conscious and there is an upper body discomfort or pain. In cardiac arrest, heart stops, person is unconscious, often no previous symptoms, person may be gasping or not breathing at all. Often a cardiac arrest occurs due to a heart attack. In primary cardiac arrest, heart stops pumping, blood in arteries are full of oxygen, often unexpected wet nest collapse. In secondary cardiac arrest, heart stops pumping due to lack of oxygen, drowning, drug overdose, or choking. Approximately 70 to 80% of all adult cardiac arrest are primary cardiac arrest. Chest compressions, only CPR. When CPR is needed, CPR is most successful when administered as soon as possible. CPR is required when a person is unconscious, not breathing normally, not breathing at all. A person in cardiac arrest may grunt, snort, or take gasping breaths. This is not normal breathing. They still need CPR. Don't wait until they stop breathing. Why CPR is important? Keeping the blood flow active, even partially extends the opportunity for a successful resuscitation once trained medical staff arrive at site. Chain of survival is CPR is a critical step in AH's chain of survival. In chain of survival, it's activation of the emergency response, high quality CPR, defibrillation, advanced resuscitation, post-cardiac arrest care, and recovery. In basic life support mainly, chest compressions, airway, breathing, and defibrillation. Steps of BLS is assessment and scene safety. You need to check whether the scene is safe or no, assess the patient, and check for breathing. High quality CPR can be performed by anyone, including bystander. Now what is this high quality CPR? There are mainly 5 critical components are there. Minimize interruptions in chest compression. Provide compressions of the adequate rate and depth, that is 100 to 120 per minute, and depth is 2 to 2.5 inches. Avoid leaning on the victim between compressions. Ensure proper hand placement and avoid excessive ventilation. What to do if you found a person experiencing cardiac arrest? You need to do 3 C's. First one is check. You need to shake a person and shout, "Are you all right?" Second one is call for help. If it is in the hospital, ask someone to activate code blue, get crash cart and defibrillator. If it is outside of the hospital, ask someone to get an AED. The third one is you need to compress the chest at least 100 to 120 per minute. In BLS, first step is scene safety. The second one is assist the patient. Shake shoulders gently, ask, "Are you alright?" If he responds, find out what is wrong and reassess regularly. Kneel down by the side of the victim. Check for pulse, not more than 10 seconds. Locate the trachea using 2 or 3 fingers. Slide the fingers laterally and feel for the pulse, at least for 5 seconds. If you do not feel the definite pulse, shout for help. In CPR, now it is CAB, C-A-B. C is compression, airway and breathing. In compression, push hard and fast in the center of the victim's chest. Airway, open the airway by head tilt and chin left. Breathing, give mouth to mouth rescue breaths. Start CPR. Ratio is 30:2. Perform high quality CPR. Push hard and push fast. The compression rate is at least 100 to 120 per minute. The depth is 2 to 2.5 inches. Allow complete chest to recoil. Minimize interruption that is less than 10 seconds and effective rescue breaths. For chest compression, position yourself at patient's side. Victim should be laid on firm or flat surface. Remove the clothing of the patient. Put the heel of one hand on the center of the chest, that is sternum, at the level of nipples, and put your other hand on the top of the dominant hand. Strengthen arms and shoulders directly over hands. Lock all joints. Movement is allowed only at hip joint. Push hard and fast, 100 to 120 per minute. At the end of each compression, chest is allowed to recoil completely. Avoid excessive ventilation, then give next compression immediately. Continue CPR, 30 compressions and 2 breaths, at least for 2 minutes, and it's 5 cycles. Check whether the person is breathing or no. Gasping is a sign of cardiac arrest. Majority of people with cardiac arrest gasp. Can be a sign of minimal but adequate blood flow to the brain. Do not stop chest compressions if they gasp. Open the airway by head tilt and chin lift. Types of breathing: mouth to mouth breathing, mouth to barrier device breathing, mouth to nose ventilation, and ventilation with bag and mask. Open the airway by head tilt, chin lift, or jaw thrust maneuver. Place the mask by C&E technique to create a tight seal over the patient's face. Don't push the mask down onto the face. Squeeze the bag to deliver breaths. In adults, 1 breath every 5 to 6 seconds. Look for a visible chest rise to confirm effective ventilation. Now we'll talk about AEDs, automatic external defibrillators. AED, a life-saving medical device used for people in sudden cardiac arrest. AED device analyzes rhythm. If necessary, it will deliver shock. There are different kinds of AEDs are available, but they all function the same. How to use AEDs? Turn AED on. Apply pads to bare chest. Analyze the rhythm. In case if it is a shockable rhythm, ensure that no one is touching a patient. I am clear, you are clear, everyone is clear. If everyone is clear, then push the shock button to defibrillate. Immediately resume CPR. AEDs are safe and easy to use and they are voice prompted. If patient returns of spontaneous circulation and breathes normally, place the patient in recovery position. Adult choking. Choking occurs when airway is blocked by a foreign object. Prevents normal breathing and coughing. Can become life-threatening within minutes. Most commonly caused by food or any objects. Common causes in adults: eating too quickly, talking or laughing while eating, drinking alcohol with meals, poorly chewed food, dental problems like dentures, if the person has dentures, medical condition affecting swallowing, example stroke. What are the signs of partial airway obstruction? The person will have persistent coughing, wheezing, difficulty breathing, panic or distress, able to make sounds. If person's airway is partially obstructed, encourage the person to keep coughing. Do not do abdominal thrust. Signs of complete airway obstruction. It is a life-threatening emergency. The person is unable to speak, no effective cough, high-pitched or no breathing sound, clutching throat, that is a universal choking sign, skin turning blue or cyanosis, and loss of consciousness. If the person cannot breathe, cough or speak, perform abdominal thrust, that is a Heimlich maneuver. Stand behind the person, wrap arms around the waist, make a fist and place it above the belly button, below the rib cage. Grasp fist with other hand. Pull inward and upward sharply. Repeat until airway clears. If the person becomes unconscious, lower them carefully to the ground. Call emergency service immediately and begin CPR. That is 30 chest compression. And check the mouth for visible obstruction. Give 2 rescue breaths if trained. Continue CPR until help arrives. Thank you.